Baclofen is a medication used to treat muscle spasms caused by certain conditions, such as multiple sclerosis, cerebral palsy, and spinal cord injury or disease. It helps to relax the muscles. Baclofen injection is used by patients who do not respond to or cannot tolerate the side effects of baclofen taken by mouth. It is important to follow your doctor's instructions for the correct dosage and timing of this medication. This medication is injected into the area around the spinal cord. It is typically administered using a drug pump that is implanted under your skin by a healthcare professional. The dosage will be determined based on your medical condition and how you respond to the treatment. If you are administering this medication to yourself at home, it's important to learn all the preparation and usage instructions from your healthcare professional. Before using the medication, make sure to visually inspect it for any particles or discoloration. If you notice either of these, do not use the liquid. It's also important to learn how to properly store and dispose of medical supplies. Do not stop using this medication without consulting your doctor, as sudden withdrawal can lead to serious symptoms. Your doctor may slowly reduce your dose to prevent withdrawal. If you experience any withdrawal reactions, be sure to report them to your doctor or pharmacist immediately. Over time, this medication may not be as effective. If you notice that it's not working well, talk to your doctor about it. Additionally, inform your doctor if your condition does not improve, worsens, or if you have any signs of infection at the pump site such as fever, chills, or redness. Some common side effects of Gablofen syringe may include drowsiness, dizziness, weakness, headache, constipation, nausea, or vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people taking this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects such as mental or mood changes, numbness or tingling skin, changes in vision, or difficulty urinating. It's important to seek medical help right away if you experience very serious side effects such as seizures or trouble breathing. While it's rare, a very serious allergic reaction to this drug may occur. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a comprehensive list of potential side effects, so if you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important not to stop using Gablofen syringe without consulting your doctor, as serious withdrawal problems can occur if the medication is suddenly stopped. If you experience any signs of withdrawal, such as itching, numb/tingling skin, high fever, confusion, seizures, worsening muscle tightness/stiffness, or changes in the amount of urine, it's crucial to seek medical help right away. To avoid serious withdrawal problems, it's essential to keep all appointments for refilling the pump. Your doctor or another healthcare professional will check that the pump is programmed and working properly during these appointments. If you must miss a refill appointment, it's important to contact your doctor right away to reschedule before running out of medication. It's also important to learn what your pump alarm sounds like, so if you hear the alarm, you should contact your doctor immediately. Before using Gablofen syringe, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to Baclofen. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using Gablofen syringe, it's also important to inform your doctor or pharmacist about your medical history, especially if you have had recent or current infections, seizures, mental or mood disorders, or kidney disease. It's important to note that this medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's recommended to avoid driving, using machinery, or doing activities that require alertness until you are able to do so safely. It's also advised to avoid alcoholic beverages and to speak to your doctor if you are using marijuana. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Gablofen syringe should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. Additionally, it is not known if this medication passes into breast milk, so consult your doctor before breastfeeding while using Gablofen syringe. It's important to be aware of potential interactions with other medications when using Gablofen syringe. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also important to inform them if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, other muscle relaxants, or antihistamines. Always check the labels on all your medicines for ingredients that may cause drowsiness, and ask your pharmacist about using those products safely. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Gablofen and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. For Canada residents, reach out to a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, slow or shallow breathing, seizures, severe muscle weakness, and loss of consciousness. Make sure to attend all of your scheduled medical and laboratory appointments. It's important to also keep up with your medication refills and plan ahead if you will be traveling to ensure you don't run out of Gablofen syringe while away from home. If you are using this medication in a pump, it is to be given continuously as an infusion. If your infusion is interrupted, contact your doctor or pharmacist right away. If you miss an appointment to refill the medication, contact your doctor right away to reschedule before the pump runs out of drug. Be sure to check the product instructions and speak with your pharmacist about how to store Gablofen syringe properly. It's important to keep all medications out of reach of children and pets. Do not flush Gablofen syringe down the toilet or pour it down the drain unless specifically instructed to do so. When the product expires or is no longer needed, be sure to dispose of it properly. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.